Good morning, Miss Ray. How are you?
Good morning.
How are you doing today?
I'm okay.
Well, good. Well, my name is Shanta, and I'm going to be your nurse today, and I'm here to do your final bedside assessment before you get ready to go home today.
I think I'm going to go to rehab today.
Rehab, that's right. You sure will be going to rehab today. And how are you feeling about it?
Well, I'm excited, really. I'm ready to get out of the hospital.
Well, good, because you had hip surgery a couple of days ago.
That's correct, on my right hip.
Well, good. And you've been doing good since you've had surgery?
Well, I've got up to the potty and hadn't had any problem with that. I do call the nursing assistant when I go. And I walked with the PT yesterday.
Okay, good. And you used that walker?
Yes.
Okay,
Yes, I
good.
went all the way down to the gym and back. They were real surprised.
Well, it looks like you are almost ready to get to rehab.
It's just getting out of this bed that's the tough part.
Well, that's okay. That's what they're going to send you to rehab for. And you'll have the rehab people and do you have family?
My husband's coming in this afternoon.
Okay, good. So he'll be able to learn and help you down in rehab. So you'll have a lot of support while you're there. So before I get started, what I'm going to do is I'm going to verify your name, your date of birth, ask you a couple general questions, and then we'll get started with your bedside assessment, okay?
Okay.
Alrighty, so I'm going to look at your armband here. Can you tell me what's your name?
Lisa Ray.
And can you give me your date of birth?
Yes. It's September the 20th.
Good. And I see you are allergic to some medicines here. You have on an allergy bracelet.
Sulfur drugs.
Okay. And what does the sulfur do to you?
Well, it usually makes me itch or either nauseated, so I try not to take it if I can take something else.
Okay, good. So we won't be giving you any of that while you're here. And I see you have on a falls bracelet.
Yes, I fell twice before I got here to do my surgery.
All right. And you know to use the call bell every time you need to get up to call for assistance so you don't fall again.
Right.
Okay. All right, great. Well, what I'm going to do is I'm just going to put your call bell right here. And then I'm just going to, looks like you've had your oxygen on. Have you been using this right here?
At nighttime they've had it, and of course that first day after surgery I had it.
Okay. Well, it looks like you don't need it anymore, so we're just going to put it back here on the wall, and we're going to turn off the oxygen here, okay? And then it looks like you did have an IV at one time.
I've been on antibiotics.
Okay, good. Well, it looks like the pump is off and there's nothing running, so we're just going to make sure it's plugged in, and we'll just push it back against the wall out our way, okay?
Do you know what my temperature was this morning?
This morning, the nursing assistant took it, Chris, and it was 98.6.
Oh, good.
So it was
Good.
normal, okay?
I'm good to go
So
then.
yes, you're good to go. So what I'm going to do is I'm just going to lift your bed up here a little bit. And then if you could just push your table over to the side for me. Good. So you got up this morning.
I did. I got up about 5 when the nurse came in to give me my pain medicine.
Okay, did you go to the bathroom?
Yes, I was able to use the bedside commode.
Okay, good. So are you still hurting now that you've had your pain medicine?
Well, there's still some burning right there in my groin area from time to time, but it really only bothers me when I'm moving and getting out of the bed. That's the hardest part, really.
Okay. And on a scale of 1 to 10, can you rate your pain for me?
Well, since she gave me something for pain at 5, it's not but about a 1 or 2 right now.
Okay,
So
good.
I think the worst it's gotten with me being on pain medicine is about a 5 or 6.
Okay, so it looks like we're managing your pain right now.
I'm pleased.
Good.
It's so much better than what it was before I had the surgery.
Okay, well, it's 8 o'clock now, and I'm going to do your bedside assessment, and if you feel any pain or discomfort, we can stop and see if you can have any pain medicine while we're finishing up your bedside assessment, okay?
Okay.
All right, so I'm just going to move this call bell right here out of our way.
Do you want me to take my glasses?
You can just put your glasses right over there.
Okay.
And then I'm just going to ask you a couple quick questions. Can you tell me where you are right now?
This is Wake Med.
Right. And can you tell me what today's date is?
September the 18th.
Yes. And it looks like according to your birthday, you have a birthday coming up.
I do.
Yes.
I do.
Are you excited?
Well, at this point in time in our lives, we celebrate it kind of quietly. We've just had a big celebration with the kids this past summer, so we won't do anything
Okay,
too
well,
special this
good. Well,
time.
happy early birthday to
Thank
you, okay?
you.
All righty, and what year is it?
2014.
All right, great. So now what I'm going to do is I'm just going to ask you to look straight forward, and I'm going to have you look to the left, look to the right, look up, and look down. Good. I'm going to put the side rail down here so I can get a little bit closer to you. And I'm just going to check your ears here since you did have that oxygen on, and just make sure there are no pressure points.
It did kind of itch back there a little bit.
Well, it looks good, nice and pink, and if you can turn this way for me. Good, nice and pink. And now I'm just going to pull your gown down here a little bit and look at your shoulders. And look at your other left shoulder here and make sure there are no pressure points there. And then I'm going to hold your arm up here. Good. And your skin feels nice and warm. Good. And I'm going to check your capillary refill. Great. Now, what I'm going to do now is I am going to check your skin turgor. Good. You stay out in the sun a lot, huh?
I'm a Carolina girl for sure.
Yes. You like to do you garden or do you like to suntan?
I do like a lot of gardening.
Good,
now, but I
good.
do like the sun. I love the beach.
Well, so just make sure you're using skin block when you're out there in the sun, okay? Because at your age, skin cancer is very prevalent, okay?
Yes.
All right. So now what I'm going to do is I'm just going to pull your gown up here. And I'm going to check the strength in your hands, okay? Can you squeeze this hand? Good. Can you squeeze this hand? Good. And squeeze them both at the same time. Good. All right. Now hold them out like this. Good. Good. All right. Push against my hands. Good. Pull back towards me. Good. Nice and strong. So it'd be important when you're using that walker that we're checking your strength to make sure you're not getting weak while you're using a walker, okay? Alrighty. So now what I'm going to do is I'm going to have you open your mouth for me, stick your tongue out. Alright, open wide for me. Move it to the left and to the right. Good. Can you swallow for me? Good. Have you been eating your diet okay?
I'm drinking really well, and I did eat a good supper last night.
Okay.
I was very surprised they gave me some meatloaf and some fresh vegetables, and
Okay.
so I had,
Well, your breakfast should be here in a little while, probably about 8:30. And so we should be finished by then so you can have your breakfast if you're not feeling nauseated or anything.
not right now. Just sometimes if they give me the medicine before I get something on my tummy, it doesn't settle well. So they've been giving me some anti-nausea pill, I think, like Zofran.
Okay.
Is that what it is?
Yes, I think she gave you some Zofran this morning before she gave you your Percocet this morning. And that was about 5.
Yes.
Okay. And you went to the bathroom also?
Yes.
So you don't feel like you need to use the
I
bathroom
think
right
I'll
now?
be fine.
Okay, alrighty, good. Alrighty, so what I'm going to do is I'm going to clean my stethoscope and I'm going to start listening to your heart and your lungs, okay?
Okay.
So I'm just going to clean my stethoscope here, okay? Warm it up here a little bit. How's your stay been so far?
Well, I came in on Wednesday, so I don't remember much of the day of surgery, and slept a lot, I think, that day.
But are you satisfied so far with all the care you've
Everybody's
received?
been wonderful. I wish I'd done it sooner.
Well, we got you taken care of, and now we're going to get you to rehab in a little bit, okay?
Yeah, I'm gonna be a bionic woman here with this
Yes.
new hip.
Okay, I'm going to put my stethoscope on you here, and I'm just going to pull your gown down, okay? All right. I'm going to listen to your heart sounds first, okay? Okay, I'm going to pull your gown up here. I'm going to pull this down. And then you're going to tuck under here. And I'm going to have you lift up right here. And listen to. Good, your heart sound nice and regular. And now I'm going to listen to you breathe, okay? If you would turn and face your head to the left and face the window and take some nice slow deep breaths for me. Breathe in and out for me. I'm just going to tuck you down right here. Good, nice, slow and deep. Alright, I'm going to listen to 2 down here. So I'm going to pull your gown. If you can hold up for me right there. Great. Now you can take some nice slow deep breaths for me. Good. Now take another deep breath and call for me. Good. Alright. So what I'm going to do is I'm going to pull your gown down. I'm going to lean your head back. And
Okay.
you let me know if it hurts at any point when I'm leaning your head back.
It actually feels better laying flat.
Okay, I'm going to put your knees up and I'm going to lay you flat, okay?
That's enough. That's enough. Thank you.
Alright, you're all the way back. And I'm going to take your head off of the pillow. Now I'm going to listen to your lungs on your back side and check your skin on your back and your bottom and your legs. So what I need for you to do is do your log roll. Now I know they've been teaching you that, so let's practice that a little bit, okay?
Okay.
So now bend your knees.
Oh, yeah, that's right. Okay.
There you go. Now slowly turn. Okay. We've got you draped nicely, and I'm just going to check everything here, looking at your skin, making sure your backside, there's no red marks on your backside. Good, everything looks good. So now what I'm going to do is I'm going to listen to your lungs, okay? So if you can take some nice slow deep breaths for me. You take some nice slow deep breaths for me. I will listen to your lungs, okay? take a big deep breath for me and cough. Now I want you to take another deep breath for me. And cough. Good. So now we're going to roll over. I'm going to listen to your belly and I'm going to check your legs. So if you roll over for me, slowly bend the knees.
Oh. Oh. Okay.
Good.
Okay. Okay.
All right, now.
Whew.
Good job. So now I'm going to come down to your belly. I'm going to listen to your belly, and then I'm going to check the skin and your legs, okay?
Okay. Can you raise my head just a little bit?
I sure can.
Just a little. Thank you.
All right, and I'm going to
That's
put your
fine.
knees down just a little bit.
Just
Just a hair. There you go. Is that better for you?
yeah, that's good.
That's good. Is that comfortable?
Yeah, that's good.
Because I need to look at your incision over here and check your belly, okay?
Okay.
Alrighty, so I'm going to pull your sheet up here. Good, your dressing is dry and intact. And I'm going to pull the blanket back here. And I'm going to expose your belly here. And I'm going to just look at it. And now I'm going to take my stethoscope and I'm going to listen to your belly. Well, it sounds like somebody's ready for breakfast this morning. All right, and now I'm just gonna feel on your belly. It's a little light palpation here.
I've had a lot of gas since the surgery.
Have you had a bowel movement?
Not this one, not since surgery.
Did you have one yesterday?
No.
So did you have one 2 days ago?
Yes, before surgery.
Okay, good. So now I'm just going to palpate a little bit deeper here. Good. And while I'm here, I'm going to check your bladder, okay? Alrighty.
I feel like I'm
Nice and
emptying it.
soft. So now I'm going to pull your gown down and pull your sheets up. Now that we have the sheets up, I am going to put your rails down. We're done with the stethoscope. Put your rails up, and I'm going to check your legs, okay? We'll pull the covers back here. Okay, well, we're going to take your SCDs off so I can take a better look at your skin, okay? Alrighty. Let's touch on your skin here. Make sure it's nice and warm. Good. And now what I'm going to do is I'm going to test your skin sensation, okay? So this is our sharp, this is our dull, And this is our cool, okay?
Yes.
I'm going to have you close your eyes, and I'm going to test it on your leg, okay?
Okay.
Can you tell me what you're feeling here?
That feels sharp on my thigh.
And where are you feeling this?
It's the same place. It feels a little wet and some pressure there.
So dull.
Okay.
And what does that feel like?
That's very wet.
That's wet. That's our cool, okay? Now where are you feeling it?
Sharp on my thigh, on my right leg.
Good.
That feels dull on my knee, around my knee.
Good.
That feels wet on my inner thigh.
All right, good. And so now we're going to check your strength in your legs. Can you bend the left knee for me?
Oh, yeah.
Good. All right. Can you bend your right knee for me? As much as you can. That's great. Good. All right. I want you to push against my left hand. Good. Push against my right. Now push both. Good. Now pull your feet back toward your head. Good. Well, I'm going to check your capillary refill while I'm down here. Good. Good capillary refill. And I'm also going to check the heels. Make sure there are no pressure points on your heels. Good. They're nice and pink. So now let's put your SCDs back on. Now you need to be wearing these at all times when you're in the bed, okay?
I really like them.
These help prevent any blood clots from forming, okay? I'm going to raise your head of your bed up here. Is that good? Are you comfortable?
That's a little high.
A little high? Okay.
That's good right there.
That's good.
Thank
right
you.
there. Alrighty. And now, I'm going to put your bed down. Make sure your rails are up. And I'm going to give you this little breathing machine right here. Do you know what this is?
I'm supposed to suck it in and try to take deep breaths. It helps me do better after surgery, I believe.
All right, and it's called your incentive spirometer. So what we're going to do here is you're going to take your deep breaths in.
Breathe out normally.
And breathe out normally first. And then you're going to put it on your mouth and you're going to suck in. Good. And then after you breathe out, you take that deep cough just like you did.
Ooh.
And your focus is you want this yellow ball to come up in here between the best and the better, okay?
Okay.
So, and we do that how many times?
Try to do it at commercials.
At least every commercial break, or 10 times every 1 to 2 hours while you're awake.
Okay.
Great, you did a good job. That was 10.
Whew, it takes a lot out of me.
It does. But it's going to help prevent you from getting a pneumonia, okay?
Okay.
So I'm going to put this here at your bedside. So every 1 to 2 hours or every commercial break, okay? And I'm putting your bedside table. I'm going to slide your trash can over here. I got your head up. And checking on your rails. We'll put your walker back here. And is there anything else that I can get for you while I'm in here?
I think I'm fine. I appreciate it.
Well, I'm going to go outside and check the doctor's orders and see if he's written for you, what time he's written for you to go to the rehab, get your paperwork started. But if you need anything,
Where's my call bell?
Let me give you your call bell. can use your buzzer to call me, okay?
All right.
Okay. And if you don't need me for anything, I'm going to leave and go to my desk now, okay?
Thank you.
All right, you're welcome.